Hello po muli. Pagpapatuloy natin ang ating pag-aaral, pulse diagnosis, large pulse, damay. Large pulse. The large pulse is a pulse that is broad and replete. It is rarely used as a separate pulse image, but is usually used as an aspect of other pulse images. The expansive dynamic of heat is the mechanism behind this pulse image. So large pulse, pattern of imbalance, heat. Pulse description. The big pulse is large, broad, overflowing from its boundary, and full. It is very similar to overflowing pulse, but it has more shape and is not necessarily rapid. So yun po yung big pulse. So description po, this pulse is wide, the vessel is wide and thick. So alam na po natin kung paano natin malalaman yung large pulse. Pag nilagay nyo yung inyong fingers, lampas po dun sa inyong fingers, ang mararamdaman nyo pag pinaikot ninyo. So key points po dito, wide, other translation, big. So yan po yung ating pulse image. So clinical significance. The big pulse generally indicates heat. So, init po ang indicates pag nakaramdam tayo ng big pulse. And its clinically significance is similar to that of the overflowing pulse. When we feel a big pulse, it is important to check this against the tongue and the inside of the lower eyelids. In true conditions of heat, the tongue will be red and the inside of the lower eyelids will also be red. Ibig sabihin, kung makakaramdam po tayo ng big pulse, marami tayong makikitang sign and symptoms of heat, mga red, yung tongue, yung eyes. So we need to differentiate the big pulse with strength from the big pulse without strength. Big with strength. The big pulse with strength indicates internal heat. So yun po, pag malakas po, ang init ay nasa loob ng katawan natin, which may occur in the heart, liver, lungs, or stomach. So nasa mga organs po natin yung heat pag big with strength. In an acute febrile disease, it indicates heat in the stomach at the chi level. So common pattern presenting with big pulse with strength are acute febrile diseases at the chi level. Liver fire, heart fire, heat in the intestine, and phlegm fire. And this appears in the conditions such as acute chest infection, intestinal infection, or heart disease. So, malakas po siya. Pag big without strength naman, malawak pero walang lakas, the big pulse without strength indicates yin deficiency. Yung po lagi nating tandaan na pag yin deficiency without strength, o with empty heat or severe depletion of blood. The simple question, sabi dito sa chapter 17, the big pulse indicates deficiency of yin and excess of yang with empty heat. Imagine po ninyo. So wala po sa normal level yung yin, pero yung yang nasa sobra dun sa normal level. So common pattern presenting with a big pulse without strength are severe blood deficiency. Yan yung kakulangan ng dugo sa katawan, or yin deficiency with empty heat. So mababa po yung level ng yin, kaya nagkakaroon ng empty heat. And blood deficiency with liver yang rising. So this pulse frequently appears in menstrual disorders and diabetes. So yung may mga menstrual disorder po ang nagkakaroon ng mga big pulse without strength. At saka yung may diabetes. So indication po, wide and forceful. Ibig sabihin po nito ay excess heat. Wide and forceless. So forceless po yung keyword, deficiency po yan. Pathogenesis, excessive pathogenic heat in the interior dilates the blood vessels and accelerate the chi and blood circulation, thus producing a wide and forceful pulse. So yun po yung ginagawa ng HIIT. Pinapalawak niya yung daluyan, yung ugat. So pag sa deficiency naman, extreme deficiency of essence or yin cannot anchor the yang, and so yang floats to the lateral margin of the vessels. So remarks po, the large pulse is not commonly mentioned in Chinese textbook. Hindi masyado ginagamit sa Chinese textbook. So big pulse, summary of clinical manifestation, full hit, kung big with strength. Yung deficiency naman po, with empty hit, pag big without strength. So combination. Big dip indicates internal heat. So tandaan po natin pag dip, may internal heat. Big wiry, naalala ninyo yung wiry, anong organ ang laging affected dyan? Ang liver. Kaya big wiry indicates liver fire. Pag big saggy, denotes empty heat with dampness. Big overflowing indicates stomach heat. Pag big full po, indicates severe chi stagnation. So, differentiation of similar pulses. Overflowing. Yun ang compare pa, no? The big pulse is very similar to overflowing pulse so far as they are both superficial. So, pareho pong natatanda ng overflowing at saka big pulse sa superficial. Large and going beyond the pulse boundary. So, pareho po siyang pag pinatong man yung fingers, inikot mo, nararamdaman doon sa lampas sa mga fingers mo. The big pulse, however, is rounder than the overflowing pulse. It has more shape and it is not necessarily rapid. So yung big pulse po, pwedeng hindi siya rapid. Next is flooding pulse. Description, the pulse is wide and forceful. So parang family siya, no? Big pulse, tapos yung flooding pulse. Dahil wide din siya. Although it is fade gently, madaling mawala po pag flooding pulse. The vessel is wide and thick. So traditional description, like the ocean wave that comes strongly but leaves calmly. So key points po, easily felt and superficial depth, wide and forceful, arrive with more power than when it leaves. Mas malakas po yung pagpitik pataas kaysa dun sa pagbaba. So other translation, overflowing, surging. So yun po yung pulse image ng flooding pulse. Yan, yung parang wave siya. Pagpitik pataas, mas malakas yung mararamdaman. So, forceful ang quality, wide, sobra-sobra dun sa blood vessel ha. So, yung pagpatong ng kamay nyo, sumusobra dun sa fingers nyo nararamdaman. So, mas malakas yung ascending niya. Then, descending, yung pababa niya is weaker. So, indication po, ang flooding pulse, excess heat po yun on the chi level. In biomedicine, sa mga various acute infection diseases, yung may severe pathogenic bacterial infection or yung may other disease also may be found in patient with adverse flow of blood caused by aortic insufficiency. Yung mga dali po sa ugat ng puso, pathogenesis, excessive pathogenic heat in the interior dilates the blood vessel and accelerate the chi and blood circulation. Yun, sobrang init po dun sa ating katawan, dun sa mga organs natin. Lumuluwang yung ating ugat. So, the producing blood, yun po yung nangyayari na nagkakaroon ng flooding pulse. So, remarks po, flooding pulse can be normal pulse during the summer. Pag tag-init daw po, ito ay normal. So, pag full naman, the full pulse simply indicates that the pulse is full and relatively hard, whereas the big pulse is larger than its boundary, more superficial and relatively softer. So pag full, mas hard po siya. Pag ito pong big pulse, mas soft. Ito po yung differentiation nila. Next is excessive pulse. The pulse can be felt at all three positions and at all three depths. It is long, wide, and forceful. giving rise to a sense of fullness. So ang key points po nito, long, wide, and forceful. Other translation po, full or replete, full and replete. Ayan po yung pulse image. Sobrang malakas siya sa lahat ng level mararamdaman nyo. Then yung qualities niya, distal, middle, proximal. Pag ginalaw nyo yung pagkapatong ng fingers, then i-move nyo distal, middle, and proximal, nararamdaman po ninyo lahat yan. Yung strength niya talagang malakas, halos ramdam ninyo yung pitik dun sa dulo ng inyong mga daliri. So, excessive syndrome indication po nito. And excess syndrome, which include pathogenic cold, accumulation, food stagnation, phlegm retention, or chi or blood stagnation. So, kung may mga ganyan po yung pumapasok sa katawan natin, excessive pulse po yung nararamdaman. Hyperactivity of pathogenic factors, then strong anti-pathogenic chi. So, ibig sabihin po nun, malakas yung pumapasok na sanhi ng sakit, pero malakas din yung panlaban natin, yung anti-pathogenic chi natin. In biomedicine, yung pag mayroong febrile disease, acute hemorrhagic shock, acute myocardial infarction, acute pericarditis, congestive heart failure, acute rheumatic fever, myocarditis, and hyperthyroidism. So, pathogenesis po, the conflict between hyperactive pathogenic factor and strong antipathogenic chi result in accumulation of chi and blood filling the vessel that the excess type pulse will be consequently occur. So, pareho pong malakas yung sinasabi natin, pumapasok yung sanhi ng sakit at yung panlaban natin sa sakit, yun, naglalaban po sila. Kaya mayroong excessive pulse. Remarks, the excess pulse can also be felt in the normal person. When the pulse is strong and calm, it indicates that the person has sufficient antipathogenic chi and some four organs function. So, sign din ito ng magandang kalusugan ng tao kung walang mga kasamang iba pang sign and symptom. So, kasi ibig sabihin daw po nun, malakas ang inyong antipathogenic chi at saka yung inyong sangpo, healthy sila. So the long pulse extend beyond the pulse position, lengthwise, and is not superficial. So the big pulse extend beyond the pulse position in all direction and is superficial. So ang long, hindi siya superficial, while the big, karaniwan ay superficial ito. Big pulse extend beyond po siya pala. So long pulse, the pulse is smooth and straight. It can be felt to extend distally, and proximally beyond the usual tree position. This pulse can be either normal or pathological. So yan po ang key points, long and straight. So ibig sabihin po yon, pag pinatong nyo ang inyong finger sa pulsuhan, pag minove nyo distal and proximal, nararamdaman po ninyo. Kaya yung tinatawag na long pulse. So, sign din po ito ng excess syndrome. Pag mayroon pong liver yang rising, tsaka mayroong excess interior heat. Yan. Ang pathogenesis po, internal excess heat can increase the movement of chi and blood. Pinabibilis niya yung galaw ng ating dugo at ng chi, which cause the fullness of the blood vessel. Yan. Kaya halos napupuno po yung yung ating ugat ng dugo. The pulse will extend beyond the usual pulse location along the radial arteries, thus forming the long pulse. So, remarks, the long pulse when the moderate in strength, sign din po ito ng good health o normal health sa normal person. So, kung moderate lang po ang lakas. Thank you po for your attention.